Will anyway.
No, it's not okay to just do it on anybody and everybody. There are contraindications, those being someone that has an obvious ear infection with fever and pain. And if there's any real issues going on, they do need to consult with their healthcare practitioner.
Experts also warn that candling should not be performed on children with ear tubes. Another common hearing-related belief, especially popular among parents of teenagers, is that listening to loud music will make you deaf.
It's fact. Excessive noise is very damaging to ears. The more you're exposed, the longer your exposure and the louder the noise, the more damage will be done. We don't know how to reverse that damage. The damage is permanent and it will cause permanent sensory neural hearing loss. So if your child's wearing headphones and you can hear the music through the headphones, then the music's too loud and it's damaging.
And some seemingly innocent things may be damaging our ears more than we realize.
Lawnmowers, leaf blowers, any kind of power tool. And it doesn't have to be necessarily excessive exposure. Repeated exposure is really the problem.
Excessive noise can also cause ringing in your ears, called tinnitus.
And you'll hear some tones.
You know, it can be normal. Sometimes after excessive noise exposure, your ears will ring. So if you've been to a loud concert, you'll find when you walk out that your ears don't feel normal and they're a little stopped up and ringing. It'll probably go away within about, 12 hours. But any ringing that comes and stays should probably be checked out every once in a while. It can signal a more serious problem in the inner ear.
Tinnitus is one of the symptoms of one of the most common real hearing issues that Dr. Roberts sees, something called Meniere's disease.
Meniere's disease is a problem with the inner ear fluid pressure. This is something which develops in any age group, in either sex. If there's anything that is typical about Meniere's, it is that it is completely unpredictable. The symptom complex is hearing loss associated with a ringing or roaring noise in the same ear, one side, pressure, head pressure or fullness, and what is most distressing to the patients is a severe spinning vertigo, which is virtually always associated with some nausea and vomiting.
You get a queasy feeling. The next thing that happens is you start to feel like you're not standing straight. You begin to stagger. So you've lost all of those senses. Meantime, your brain knows exactly what's going on. And you're powerless because you can't stop the attack and you can barely control it. All of this is being accompanied by the fact that your ear is ringing. Sometimes not badly, to a point where it's roaring.
It is a relatively common problem. I might see 2 or 3 patients, new patients, in a given week with it. The least invasive treatment, there are a fraction of patients, perhaps 10 or 15% of patients who have the opportunity to control their symptoms by dramatically reducing their salt intake. But there are a lot of people who have Meniere's where changing the salt intake does not help them. The next step that I would typically employ in taking care of a patient with Meniere's would be to administer a mild diuretic. Probably well over 95% of patients are quite well controlled with a low-salt diet and or a diuretic. But there are some people who continue to have disabling episodes of vertigo, and they happen with enough frequency that they're interested in pursuing further options.
There's an awful lot of research going on all over the world, and they've come up with some pretty neat things. Besides some experimental drugs, I have here a machine which I bought, it's just about a year ago that I bought this machine. It's a machine that's based on research on the types of pressure chambers that they use to depressurize divers and pilots who fly planes at high speeds and high altitudes. This machine is called an overpressure machine. It actually increases the pressure into your ear with all of the delicate membranes that are in there.
much as one might rub a swollen wrist after it was sprained to try to get some of the swelling to go away. And the only invasive part of using that is that it is required that you have a hole in your eardrum, or the pressure